Hey, you should be good.
Thanks.
Good morning, everyone.
Thank you, Penny. And I want to say good morning, everyone. Welcome. I'm Dave Roth. This is the fifth meeting of the Health Equity and Access Response Team. And as we're gathering for this meeting this morning and chatting a bit online, I'm just so aware of how different it feels to be gathering this morning than it felt back in mid-December when we last met. The sun was shining that morning, the vaccine had been introduced, and there was this sense of optimism. And today, after the events of this week, it just feels so different. And so I'm aware of all the emotions that I'm feeling. This is my first big meeting since that news hit on Wednesday. And I want to acknowledge with all of you that our feelings are raw, our anxieties are heightened. There may be anger, there may be dread. And as we learned just a couple of minutes ago, there is hopefulness around what this moment can mean for us. So I want to be especially attentive this morning as we meet to how I'm feeling during the meeting. And I want to be attentive to what each of you is saying and feeling, and being aware that I don't know what's going on inside of you right now, only I know that it's big and important. So a little different context for our work today. That said, thank you for being here. We have an ambitious agenda today, as we have had each time. We're going to spend some time on vaccine again, an update on the changes taking place. We're going to do a really hopeful activity. We're going to learn about some events that are going on to build vaccine confidence, some that have happened, and learn a little bit about what worked about them, and some that are anticipated so that you'll be in a position to encourage your constituents to engage. We're going to hear back on work that's being done on communication, mental health and substance use, and PPE and testing. A lot to get through. I encourage you to stay with us through the full time. And let's see, let me give a couple of ground rules before we get started. I want to remind you that this is a Zoom meeting and it is being live streamed to the public. We're doing this to build our team and to be transparent all at one time. Please be aware while you're on of background noises. Mute yourself if you're not talking. And when the discussion is full, as it's going to be for most of this morning, when all of us are engaged in it, I encourage you to keep your video on as much as you're comfortable to help us get to know each other. When we started this team back in October, most of us didn't know most of us. And that's changing. Now I think many of us know many of us, and we're moving forward. So I appreciate you for being here and for keeping that video on where you can. And of course, not everyone can. So let me first invite Chris Hoff to the microphone and ask Chris to give us an update on vaccine.
Excellent. Hi, Dave. Can you hear me okay?
Yes.
Okay, excellent. I'm going to pull up a couple of slides, and if you can just confirm for me that you see those.
Yes, we see them.
See a full slide, or do you see a presenter view? Okay, excellent. Hi, everybody. Oops, sorry, Dave.
It looks like we're seeing a full slide.
Excellent, thank you.
Chris, I'm seeing the presenter's view.
Yeah, presenter view.
There we go.
Thank you. Always got to double check. Otherwise, I'm going to have one of you present.
There you go.
Yep.
All right, thanks everybody. Hi, my name is Chris Hoff. I'm the Director of Community Health Resources at the Health Department. And yes, love the opportunity to provide an update on vaccine distribution. Another reason for hope since the last time we've met, we've had more people vaccinated in DuPage. And that's one way for us to get out of the horrible despair of what we've experienced with COVID. We crossed a very unfortunate milestone in the past week that over 1,000 people in DuPage have lost their lives to COVID-19. So very much still an issue that we need to be working our way out of. And vaccine is one of the important ways that we'll do that. So I just want to give an update on what's changed since the last time we've met, help you answer questions that you may have, and then ask that you help get this information out to your constituents, because we know lots of people have questions. And as soon as we all hear the vaccine is here, the next question is, well, when can I get it? Where should I go? So we want you to know, about the vaccines, about what's happening in DuPage right now and what to expect. So, and really to reinforce over and over again that vaccines are one of the tools we have to fight the pandemic. We don't want to be in a situation where we have tons of vaccine and people still have questions or aren't sure if this is for them or don't know that they've had time to really think about it. So there's some great materials out there from CDC, from us, from others, and we would encourage you to continue to draw from these to share information with people now, even if they can't get their vaccine this week. We want to be making sure that people have access to good, clear information and accurate information as well. So our goals are to improve confidence in the system. We really want people to trust that the vaccine works, trust that they have a system they can get access to. We want to empower healthcare providers and by extension, you all, that you have confidence in the system and the vaccine so that you can then help your clients and stakeholders make good decisions. And then provide as many opportunities as we can to engage with you all in the community, to answer questions, to share updates, to make sure that it's clear, transparent, and invokes confidence. So right now, we are receiving 2 vaccines in DuPage County. Illinois has received 2, and by extension here in DuPage, we're receiving those as well. That's the Pfizer and Moderna vaccines. You've heard a lot about them. They're both approved for use in adults. Pfizer is 16 and up. And the important thing to know here too is that there are more vaccines that are being evaluated and we expect to come to market over the next few months. But right now we have these 2 vaccines. They work very much in similar fashions. So if you have access to either one, we recommend that you take that and certainly learn as much as you can about those vaccines, but know that they're both very effective, both work in almost an identical manner, and both are recommended for use to address COVID-19. Safety events are being monitored closely. So we get a lot of questions about, well, what about these people that have had severe reactions? And just important to note that vaccine safety is really a critical component of getting vaccine out. It's not just vaccinating people and leaving it at that. It's following up on anything that may happen. You saw some media reports this week that the incidence of safety events is very low. There are some, they're mandated to be reported. So you can expect to see more. And that's a good thing that this is coming out because it helps people understand how these vaccines work and what side effects they might expect. And this is good information for us to be seeing. So when you see these reports, really important to help promote them as a way to observe and understand what is going on with the safety profile. Most importantly, and I think this is one that hasn't gotten a lot of attention, we've gotten a lot of questions, so I just want to put this out for you too, that even after you get a vaccine or as people start to be vaccinated, they need to keep wearing a mask. They need to keep washing their hands, keeping their physical distancing. At this point, having that vaccine doesn't fully protect you. No vaccine is 100% effective, so important to know that it's not a free pass, that no masks, no physical distancing, and we still don't have enough information to know whether having that vaccine cuts down on transmission from person to person. So I think we'll find more of that information coming in the weeks to come, but just want you to be clear and want others to understand that that vaccine is so important to minimize the potential for you to get really sick and certainly for the really worst outcomes. But we don't know enough yet to say that we can stop doing those other prevention measures. So really want to help you all understand that and help you share that with clients. It's great news. Since the last time we've met, over 18,000 people in DuPage County have been vaccinated as of January 4th. We'll be updating these numbers at least weekly, and it's never enough, right? We want everybody to be vaccinated as fast as we can. But if you step back and reflect and think about the fact that over 18,000 people, our coworkers, our colleagues, our neighbors, our family in some cases have been vaccinated, that's such a hopeful situation to be in, and that number will continue to grow. It's our goal to get that out as quickly as possible, working to expand the network of providers that are providing vaccine. These numbers won't always match exactly, so I want to caution you if you see a number that says, we've received this much, but only this number has been vaccinated. Those numbers are reported, in different places, so it takes a little bit of time to catch up. So really focus on that bottom line. How many doses have been administered? How many people are now starting to get some protection from COVID? And it's just really, really exciting now, a year into the COVID response, that 18,000 people have some protection. We're starting to get into those second doses now. In terms of prioritization, I know there's a lot of questions about, how do we make decisions? Who's at the, the front of the line? Who's next? How does this work? So recommendations about vaccine are guided by the Centers for Disease Control. They have an advisory committee on immunization practices that makes recommendations about who should be vaccinated and when with all types of vaccines. And then the Illinois Department of Public Health then also may make some modifications. And you saw that this week where the governor indicated that Illinois would include seniors age 65 and up in their second phase. while the CDC had initially said only 75 and up. So these are the two groups that we look to for that prioritization. You can kind of watch for updates from these groups, and we'll likely be adopting very similarly to what Illinois says. So there's some consistency across Illinois counties. In terms of those groups, I think you probably know these, but I just want to refresh and make sure that
Chris, you've frozen on us.
that 1A group is first. So the first three groups we talk about. Can you?
We got you now. We lost you for a little bit. Now we've lost you.
Okay, can you hear me?
Yes.
Okay, I'm going to turn my video off for a minute just so I can keep going, and hopefully that'll help the internet. Thanks for the heads up.
Sure. Now you're clear as a bell.
Okay, so the priority groups again, 1A, healthcare workers and residents of long-term care facilities and staff in those facilities, really trying to protect those workers that are providing that healthcare infrastructure. Again, this is an infectious disease pandemic, so if we don't have healthcare, we don't have a response. So really making sure that those folks that have worked on the very front lines of COVID for the past year have protection, and we're working our way through that group. In DuPage County, between those healthcare workers and long-term care facility residents, there's about 58,000 people in that group. So when you look at the numbers of vaccine we've received and gotten out, you can see we still have a ways to go to get through that 1A group. Once we make substantial progress with that group, we'll move on to 1B. That 1B group includes frontline essential workers. You can see some examples here. And then based on the governor's announcement this week, all Illinois, all DuPage County residents age 65 and over. And that group, that 1B, just to put it in context, is about 270,000 people in DuPage County. So, pause and reflect that for a minute when you think about, okay, well, I'm in 1B, when can I get vaccine? We may be starting to vaccinate that 1B group at the very beginning of February. We expected it would take about 8 weeks to get through the 1A group. It's going to take several months to get through that whole 1B group based on the amount of vaccine we're getting and the capacity for the health system across the board to be able to vaccinate. Just to recognize that number is really big. So 270,000 people in that 1B group.
Clean your room, make your bed. Make sure those two things are done. Get all this stuff picked up.
Please, if you're not speaking, please mute.
My bed is made. So these slides, and we'll share these slides after the meeting, and they're available on the State Health Department website. You can see the link here below. There's some additional detail about examples of who qualifies. And I just want to remind you too that these lists are not exhaustive. So just because you don't see a very particular specialty or subtype on there doesn't necessarily mean they're not in that 1A group or not later on. So you need to look at these with, these are examples of professionals that fit in these groups. If you have questions, certainly let us know, but know that it's just not possible to have every potential specialty or subtype listed here. So these are the overview of 1A. This is kind of where we've started and where we currently are today. It includes long-term care facilities, these other congregate settings, and this is our focus to get through these groups as quick as we can before we move on to that next phase of 1B. And then some examples about 1B. When we talk about frontline essential workers, what are some examples of those? That includes first responders, like fire, law enforcement, 911, education is there, teachers, support staff, daycare workers, really trying to make sure that that sector has some protection. And then some critical sectors of our economy that really keep things going, including grocery store workers. We all need those folks to be protected and make sure that those that have worked tirelessly for us all are protected in the next phase of the COVID response. We've gotten questions about, well, how do we, okay, there's 200,000 people in this group. How might we prioritize? We're looking at areas that workers have high rates of transmission or where we've seen outbreaks. Certainly looking for where people are at increased risk because of their age or underlying conditions. And also recommending that people get vaccinated, those that have not necessarily had COVID. If you just had COVID, it may be better for you to wait to get vaccine and give that vaccine to somebody that hasn't had that protection naturally from the disease. So there'll be more coming out about this, but I want you to be able to think about and understand how we might prioritize within those groups. Lots of questions about, well, when do we move from that 1A to 1B? What day will it be? How many vaccines do we need to get out? There's definitely some quantitative things we're watching, right? So there's, 43,000 healthcare workers in DuPage. We want to get through a big chunk of that, but we're also going to be watching for these qualitative things that are, if we have a lot of appointments out there, but there's not a lot of demand, that may tell us that it's time to move on or start vaccinating some of those folks in 1B. And the phases may overlap a little bit. And this is a visual of that it's not going to be a black and white cut line on a certain date or a certain number of vaccines. We may continue to vaccinate in 1A and then start to do a little bit of the folks in 1B, and that'll spread out over time. So current work that's going on in DuPage for you to understand, you to take back to your stakeholders. Like I said, over 18,000 individuals have been vaccinated so far. That's of early this week, so that number is definitely higher. We'll continue to update on this, likely at least once a week. Those numbers are all reported centrally to the state, so we don't have immediate access. So we're going to update you as best we can on how many people are out there who have been vaccinated. We're currently, all the vaccine that comes into the county is allocated out by the health department. So we're working closely with health systems, healthcare providers, pharmacies, and others to direct where that vaccine goes. We are running clinics through the health department, about 1,500 appointments per week, and opening those up on a rolling basis. So we are contributing to getting vaccines out in conjunction with hospitals, pharmacies, health systems, other partners. And those will really expand over the coming weeks. You can expect to see more information coming out about that every week. And our focus right now really is on making sure that phase 1A group, healthcare providers have access to vaccine, are able to be vaccinated before we move on to the next group. And then just to note that the information continues to change. Even every day we're getting new information. So we're committed to turning that around to you and helping you understand, and just hope that you'll recognize too that this is the most significant logistical healthcare and really any operation we've done to get this many people vaccinated in the entire country at the same time. So really a complex undertaking, and one that we're excited about getting vaccine to people as quickly as possible. In terms of what to do, so, where do I get information? How will I know vaccines available? We have a great website, and one of the things that we're recommending that if people want to get updates pushed to them, so they're not just waiting to hear, is to sign up for the newsletter on the site here. That newsletter then allows us to contact people directly. So we have their email address, we have a way to contact them to say, great news, we have more appointments open, here's where you can go to register. Very soon, we hope to be able to say, great news, here are vaccine appointments at pharmacies. Go to this link to find those, and really help people understand where to go. One of the biggest questions we get is, how will I know exactly when vaccine is available? We're going to be putting out information in places like this, on social media, on the website, in media releases. It is not a secret, and we will continue to push information. If you need anything, please let us know. More than anything, we want people to know that they will have access to vaccine. It will take a little bit of time, so we want to be honest with people that we're not going to be able to vaccinate, the entire DuPage population in the next 2 weeks, and that we're committed to giving updates as we know more about how much vaccine we have and who's available to provide that. So I think that's my slot, Dave. I'm happy to take questions now or take them later. You tell me. And Dave, you're on mute.
Thank you. This is what I want to recommend. Let's take a couple of minutes for questions, but we're going to limit them because there's going to be a meeting 1 week from this morning that will be dedicated exclusively to vaccine confidence. Everyone on this team will be invited to participate in that. It's a deep dive. Kara, if you're with us, you're a co-chair of that meeting coming up in a week. Do you mind taking a minute to describe it? Then we'll come back here for some immediate or urgency questions for Chris.
Okay, very briefly, actually, Dave did a great job of giving the save the date, but let me tell you, so next Friday at this same time from 8:30 to 10, we have a regularly scheduled Impact DuPage Steering Committee meeting, and we will be opening up that meeting to other attendees, including everyone that participates in this work group. So stay tuned for an agenda and an invitation that will come out, I expect today, but it will be from 8:30 to 10 o'clock next Friday morning. The intention of that meeting primarily is nonprofit health and human service leaders throughout the county to be able to communicate updates that will help give them information, the most timely and credible information about the vaccine and about the plans here locally, both to the extent that we're able as it relates to the availability of vaccine for their internal organizations, and also equally for the families that they serve, which we know is acutely important, where there's a lot of anxiety in the community right now. So we'll be talking to a lot of that. Some of that by virtue of your participation in this group may have some duplication of information that you've heard before, so I apologize for that. But also it will be timely information for everyone, and we'll also have a chance to talk through strategies and really bring a larger group together to talk through what we know is going to be this critical next step of being able to create confidence both within our workforce and then separately within the families and populations that we serve to ensure that these next phases continue to roll out smoothly. So stay tuned.
Thanks, Kara. So the couple of things I want to do as we move to some questions for Chris. First, I want to say hi to Arista. We're going to give you an opportunity to introduce yourself in a minute. I'm sorry that I missed that at the start of the meeting. And then Chris, I want to kick off the question. Sima has posted a question, nonprofit workers or essential workers?
Yeah, great question. And so nonprofit, it'll depend on what services that nonprofit is providing. So there's not a blanket category for non-for-profit workers. Thinking that one be, if you're a non-for-profit, you're a healthcare worker, you're providing healthcare services. That healthcare definition includes those who are paid or unpaid, who have exposure to COVID patients. They could be included in that 1A group. If you're a nonprofit, providing education services or daycare, in that regard, you might be included in that 1B group. So it really depends what drives that prioritization. The best way to think about it.
Thanks, Chris. You've frozen up on us again.
Is, what's my risk of exposure? And all right, I'm gonna turn my video off and hope that helps. Sorry.
All right.
I even comb my hair, but I guess it's so I don't know where I broke up, but I think the best way to think about the prioritization is that the idea behind prioritizing groups is recognizing that while everybody needs access to this vaccine as quickly as possible, it should be really based on what's your risk. So healthcare workers were up first based on the fact that they're exposed to COVID patients and those that may have COVID and are really critical to keeping a functioning health system in place. As the groups move on, it's really tailored to those that are at highest risk of disease and really provide that core function to keeping our ability to respond and manage the COVID response. So very rarely will you see a blanket like all people in this group are covered, and we're going to try to help understand why people in that group may be up. So does that answer that, Dr. Asfar?
Yes, thank you so much. Just the food pantry and other workers, how they should contact the health department for COVID-19. Because many are asking me that, how to communicate. So I got that information now. Thank you.
Yeah, and for anybody that's interested, you can use that link on our website to sign up, and we'll put the link in the chat there just to get information and make sure that as we get updates, I think you saw this week through the governor.
We've lost you again, Chris.
There's an announcement that we're still refining exactly. Thanks, Dave.
And Mary asks, can you specify about food pantry employees and volunteers? Are they included with grocery workers?
That's a great question. It would make sense, but I haven't seen anything that specifically calls them out. Has anybody else seen anything that specifically identifies pantry workers? I assume not if you're asking, Mary.
I have not either, Chris. I'll try to take a look.
And this is Rashmi from the health department. I have not heard specifically about food pantry workers, but when there have been similar questions about blood banks and other like critical supply related workers, then they're typically, well, I guess for a blood bank it would be higher, but I'm thinking it would fall under frontline essential, but we can confirm.
Would be really helpful. Thank you.
Very good. Are there other questions of immediacy for Chris?
I have a quick question. I have some constituents asking if educators of higher education, meaning like COD or Elmhurst College, because it specifies K through 12. I'm assuming that educators past grade 12 are also included.
Good question.
It's a great question. The information that came out from IDPH in that slide, and I'll pull it back up, does list that K-12, and I think the priority there is making sure that kids that are learning in large groups in person. We know that's a really, really critical group to get back to school as quickly as possible. So I think it's fair to assume that those are up first. I haven't seen anything on that higher education. I think, typically that we've seen them later on, as there's more opportunities for remote learning in many instances, not all, and that older students, older learners, maybe at higher risk for transmitting disease. We're not going to bring them back in person immediately. We really want to focus on that K-12 group first and make sure that they have access to that vaccine for the support staff and teachers. Anybody else from DCHD want to add to that? Have you seen a specific statement?
I have not, but I will add it to the list with food pantry workers to research further.
Much.
Very good. Thanks, Lynn. Thanks, Chris and Adam. Anything else before we move to the next part of our agenda? All right. Well, so the first thing I want to do is make up for a lost opportunity at the beginning and invite Arista Wang. Would you mind introducing yourself, and welcome to you? Would you be willing to tell us name, affiliation, and what brings you here?
Hi, good morning, everyone. My name is Arista Wang. I'm a worker at the Midwest Asian Health Association. It's called MAHA. And I'm responsible for their immunization program in the suburban area. And their office is located in Naperville. And MAHA's headquarters office is in Chinatown. So it's nice to meet everybody. MAHA is a nonprofit organization with the mission to reduce health disparities for Asian Americans and Pacific Islanders in the Midwest. And the programs, we have several programs like Affordable Care Act Education, Consulting and Enrollment Community Health Center, and the Hepatitis B education screenings, a free hepatitis B clinic, and immunization programs, provide obstetrical education and screening, medical consultation, and diabetes education and consulting workshop, and to health professional students, substance abuse prevention, employment program for people with disabilities, Asian mental health clinic, suicide prevention program, and also MAHA has research projects with UIC, patient-focused type 2 diabetes study, hepatitis B study, Asian mental health study and prevention strategy, and cardiovascular disease prevention among Chinese populations, and so on.
Well,
And
welcome. I want to say welcome to you. And I don't know if you realized this as you were speaking, but eyes were opening and ears were perking. So if you were willing to put your contact information into the chat box, I'm going to imagine you're going to hear from a few people after the meeting to learn more. So thank you for being here. Appreciate this. And I know you're going to have a role in just a minute. And so I want to ask Kara if you would guide us through item number 3 on our agenda, which is recap debrief of some excellent vaccine confidence activities that are going on that feature many of the people in this room.
So the first thing I wanted to say is I just want to savor the moment for a second that we are actually ahead of time on our agenda for what I believe is the first time in every time that we've ever met as a group. So I'll endeavor to ruin that quickly, but let's see if we can't continue to exceed expectations. And the great news is there's sort of 3 parts to my portion of this community event report out, and we've actually addressed C in large part already. So I'll just say again, that there's so much energy, enthusiasm, questions, concerns around this issue of both eligibility for vaccine and also addressing all of the questions and concerns that people have. And so we're working on this from the perspective of reaching out directly to the community, reaching out to frontline workers who intersect with the community, and then reaching out to community leaders and health professionals and human service professionals to try to make sure that at every level, people have the information they need to be able to do their part in this process. We'll address that leadership and health and human services component next week at this meeting. But the really exciting news since the last time that we met is that we are seeing some building capacity within our community to be doing direct outreach into the community. And so this morning we want to talk a little bit about, I think actually Mila, in your presentation of the community subcommittee discussions, we'll do a little bit of talking about some of the other planning that is underway at the health department for future events that will continue this effort. But today we wanted to celebrate the success of NAACP's event this week titled Staying Alive. And we're going to ask Janice to talk for about 5 minutes about the experience of who attended and the reception and the kinds of questions that were coming at that event earlier this week that I think went very, very well. And we also asked Arista to join us because Kim Seifert and I had a chance to talk to Arista and her colleagues yesterday about some of the events that MAHA was doing and some of their learnings from trainings that they've been doing directly out to the Chinese-speaking community in this region. And we wanted to report about some of that as well. So with that as a frame, I'm going to ask if Janice could give us about you could talk for a lot longer than this, but probably a 5-minute overview of what happened on a night earlier this week and who joined you for that discussion and what your perspective was on its successes and its learning.
Thank you, Kara. We had, I believe it was Tuesday evening, a 1-hour discussion, a COVID-19 conversation, staying alive, because that is our goal, to stay alive, okay? And by the time we began, we recorded about 255 registrants. Kara, our group met last night to discuss, what could we have done better, different, or what do we do next? Because in our closing poll, 87% of the participants indicated they wanted another conversation. So we will have another conversation. With the help of our partners, we were able to get the word out. Obviously, to have that many people register, we had a lot of community. I can't give you exact numbers as the breakdown. We're sending out a survey later today or early tomorrow morning. But there was a significant number of community residents who signed on. We had a lot of organizations. We had professors from Harvard University. I don't understand quite how that happened. We had representatives from the governor's office, and one has specifically gotten back to me and said she thought it was excellent and she's encouraging us to go forward with this. I've actually had a couple of people who have contacted me and said they're going to get the vaccine now. And ultimately that was the goal, is to lead people into making an intelligent decision, not telling them what they ought to do or what they need to do, but giving them the information to make that decision for themselves. One of the problems I think we encountered, we lost a lot of people because, signing on 200 plus people at one time was an enormous task. And we had 3 or 4 people who were, constantly pressing that admit button. In fact, even I was, which kind of threw me off in terms of thinking about what do I do next? So we've got to figure out, how do we do that? Is doing it via a webinar a better option? The only problem we discussed last night was we wanted to keep the conversation interactive, because that's what a conversation is. And again, we don't want to fall into a situation where we're telling people what they need to do. We were able to do a very short, brief needs assessment and ask several different people, what information is useful to you? What do you want to know? And one of the things we found out was the necessity of consensus building. People are more likely to receive information if they are not told what they need to do, and if we are considering what their needs are because we have listened to what they've said. All in all, it was a surprisingly successful event, even to the point, and David, you touched on this, about this could be a model. An organization out of Chicago, Teach, and I think I copied you guys on that, sent me an email wanting to know, well, he wants our slides, he wants everything, okay? But they want to do something very similar in Cook County. But thank you to all of our partners, including the DuPage County Health Department, Access DuPage, and DuPage Federation. Thank you.
Thanks, Jan.
Okay, the only other thing I'll ask you to add is, can you tell the folks a little bit about who the speakers were that joined you? Janice was one of our speakers, but who were the other folks that were presenting at your session? And then we'll move on to talk a little bit about MAHA.
We had two physicians from Edward Elmhurst, doctors Mark Gomez and Daryl Wilson. Dr. Wilson is actually an emergency room physician. So he has been working with COVID patients since, he believes, last December, January. We had Faith Neong, who is a community nurse in Aurora. She works both with, her client base is both Kane County as well as DuPage County. And we also had Michael Isaacson from, who's I think the community manager for Kane County Health Department. And of course, we had our own Karen Ayala, who is our very proficient director of the DuPage County Health Department. I believe that covers it. But I thank everybody. It was, I don't think I could have planned it any better, so I'm not taking credit. It was just one of those things that just kept evolving. And before you know it, we were like, wow, we didn't think it was going to get this big, but it did. And again, it was well received, and since 87% of the respondents said they want another conversation, we will have another conversation. Thank you.
Fantastic. Thank you, Janice. So Janice represents sort of a local and very recent effort, and Arista and her colleagues at MAHA have similarly been engaged in efforts to do outreach directly to the community. And in your case, MAHA took a couple of steps. And so I wonder, Arista, again, with the idea of probably keeping this to 5 to 10 minutes, if you'd be able to talk a little bit about some of the pre-work that you did in anticipation of the community event that you hosted, and then also the content of the event itself. It was really interesting for me.
Hi, everyone. Again, from Arista, and we hold a town hall meeting on December 29th at night. And we had around 500 people attend this Zoom meeting. And we planned about 2 weeks, and we sent out our invitation, most through their WeChat. Most Chinese use WeChat as our social media. So we have partners, work groups to work together. It's around 20 partners or 20 groups are working together. And the reason we want to hold this, we did one survey before their town hall meeting. And would like to take a few minutes to show you their survey we had. Karen, it's okay. I shared the slides with everybody.
It's fine with me. Penny, is that capability available?
Yes, you should be able to share your screen.
Okay,
At the bottom, there's a toolbar that says, and you'll find the share screen.
sure. Okay. Okay. Is everybody can see okay?
Yes.
This is the we did the immunization service about specific about COVID-19 survey. And the mission, I don't need to talk too much, is reduce the health disparities. Let me go to okay. The service of survey we conducted between the November 14th to December 5th. Survey method is through WeChat. Total participants, 286. 100%, there's a female and a male percentage, no big difference. Age group, all the age group, but most more 40 to 8, the age groups has more populations. 100% Asian participants. And the zip code is from all over Chicago area, but this is 60616. This is I checked, it was mostly from Chinatown. So this population mostly from Chinatown has more. Okay, this is their main concern and barrier from this survey. Major concern was vaccine side effects, have 33.4%. Thus is a number shows has 210 people participate. And vaccine has 43%. Total, their effectiveness. People doubt about, oh, is the vaccine effective? So that is 43%. Most of the barrier is vaccine cost has 45.5% people. So now since everybody can receive the vaccine for free, so this is not a big issue. Then is language barrier. The reason we can, okay, this has 23% people. Then transportation. The reason we conduct this because we want to use the a lot of people, the language they can understand to find the expert about the vaccine to pass the message to them and erase their worries, concerns. And then we invited a doctor degree, the pharmacist from California. We saw his presentation was pretty good. Okay, thank you. And we saw his presentation and we invited him to join us, give us their presentation. And also we have 3 parts. One from a health department. It's from their Will County public nurse. She's given their policy. We don't know their from DuPage people, DuPage Health Department. So we found one from Will County. So she give their, like today, give their policy who will receive first. We received a lot of questions about the vaccine individual. Most the question like besides introduce about the difference of their vaccine and the side effects, probably we have a basic of their research and the feedback. And a lot of questions like individual, if both are going to get going to have baby, it's safe to have a vaccine. And if someone has a kidney transplant, it's safe to have vaccine, and so on and so on. Also, what else? Mostly is afraid they're okay. The doctor covered a lot of knowledge about this vaccine. So there's a lot of people after this after their town hall meeting, they feel more comfortable because they will erase a lot of concerns from them. A lot of questions we may in the future, if you need, we can share with you. And yesterday, my executive director, Dr. Hong, also shared with Kara and Kim. And if you guys want more, I can send you an email in the future. Is that sounds okay with you guys?
Be great.
Okay. Okay.
If I can interrupt for a second here, Arista, I'll say that a few of the things that really struck me as I was listening to Arista and her colleague, Dr. Hung's presentation was first and foremost, the fact that they had done this survey and had such good information to drive the way that they presented the detail, that they'd used social media so effectively to generate a lot of community interest, and to have 500 and to have 250 folks as Janice and her team did, these are really great numbers and what we want to be able to emulate in our efforts. But they also generated and invited a lot of questions before the event, and they used those questions that they received to direct the content that the three presenters gave in the course of their prepared presentation. So it was about a 2-hour presentation, which is long, and you're really a credit that they were able to keep people engaged. But they had a primary care provider as well as a researcher and academic, as well as a policy-driven local person, and they all presented different pieces of the puzzle, but what they presented was directed in large part by what people had questions about. And then they similarly allowed for a lot of time at the end of the formal remarks for question and answer. And I think that we all saw during the event that the NAACP held earlier this week, that there were a lot of questions that came up in that chat box, and they really kind of telegraphed where the community has anxiety or concerns. And so they tried to anticipate some of those questions and put them into the beginning presentation, but separately they allowed for a healthy amount of time at the end of the presentation to also respond to those questions that came up during the course in the chat. Sometimes we have so much prepared content that it can be difficult to sort of reflect on what's happening in the room. And I think that they did a really nice job of that. And testament to that, Aresta, was what you guys had shared, that at the end of this 2-hour event, you still had north of 100 people that had hung on because they still had things they wanted to talk about. So there was really just a huge appetite. The other piece is that you, and this is something we're going to have to reflect on, is that you provided the content exclusively in Chinese. That means that I can't listen to it, but it very much hit the target of your audience. It really isn't relevant whether I can hear it or not. I think we're going to have to make some decisions as a community about the degree to which we want to make each event inclusive for all partners, which of course is one very compelling argument, or whether we want to instead go deep and really have some segmented town halls or communication events that are really intended to focus on particular communities and perhaps some of the unique concerns of that community. I don't think there's a right answer and a wrong answer, but I do think it's something that we're going to have to give some thought to. So I think we can probably open up to questions that folks might have, but I just wanted to commend both MAACP and MAHA for sort of setting a stage and giving us some reason for optimism that this work is going in the right direction and that we have some folks we can learn from here.
And Kara, if I might add, again, a special thank you to you and to DuPage Federation, because was it that morning? I think it was that morning. You guys pitched in and we actually offered the presentation in both English and Espanol. There was a simulcast. So we were able to reach out to our Latinx community and give them the same information. And we've actually, since that time, we're trying to put together the video. And I believe David offered to maybe do subtitles because there's a congregation in Bensonville that's Hispanic. And they would like, the pastor there would like to show it to his parishioners. So I agree that we need to figure out how do we do this where we broaden our reach throughout the community, respecting everybody's ear, what they hear, how they need to hear it. But again, thank you.
And Jan, I could.
We have a, yeah, please. I was just going to ask if anybody had any questions before we moved along. Yeah.
And I'll piggyback real quickly as we go to those questions that it is entirely possible to simultaneous interpret from English to Spanish, so that if you are looking to reach a Spanish speaking audience with an English presentation, please reach out to us. We have the resources to do that. We have interpreters now who've gained a skill set in being able to do that at DuPage Federation. I'll drop it in the chat how you could get a hold of us for that service. So now, other questions, comments, thoughts about what you've heard about these presentations? Kara, if it's all right, what I would like to do is, so I'm looking around at the room and I'm watching eyes light up and I'm thinking folks on this meeting who have constituencies. I'm looking at Lynn and Reverend Miguel, I'm looking at Evan, and I'm thinking you're probably asking the question, how could we do such an event like this? And learning that with the presence of medical presenters and lots of space for question and answer and a desire to listen and respond to where folks are at, this can be put together, as Arista noted, in 2 weeks' time. And so,
although I don't think anyone would object to having more. I want to say that I think we're going to have a heavy lift in this space, and I think that our community partners are actually going to be a critical component of that effort. I think that the good news is that we have a strong partner in the health department that might be able to provide us some backbone to the way that we put together these presentations. And I was very encouraged to talk to Kim Siebert, who is not able to join us today, but to hear more about some of the work that's going on, not to direct precisely how each of these community events might look, because I think each one can and should be informed by some feedback from community partners and key stakeholders, but to sort of think about what a structure might look like and how there might be some support to ensure that we're able to stand up these community presentations, invite the right folks to join us, and then have a very productive conversation. Neela, do you think that a part of your communication subcommittee discussion might talk a little bit about some of those town hall events, as well as some of the PSAs and other communications that the health department's working on?
Yes, and I'm gonna check here to see if you can see, I tried sharing my screen here to put up a new draft document that Kim actually put together. Can you all see that?
yes.
Okay, great. So, you know, we're not, I'm kind of sharing this when it's just quickly become available in draft form. I wanted to talk a little bit about it during the communication subcommittee portion, which I think we're right on time with, right, Dave?
Yes, I say we go ahead and segue. I think we're ready.
Okay, and Kara, please, you know, continue your comments into this, this section, because I think it ties up. So Kim had been speaking with Arista. She had, she was coordinating the health departments of the Staying Alive event and had been involved in much of this communication discussion. So one of the aspects that we had talked about are these town halls, which is, a little bit about what's already started. So in January, it's exciting. We're already hearing about 2 of them. And I know Kim is talking to a few subject matter experts and looking at shaping up some town hall ideas that would take place potentially at the end of this month, but for sure in February. So that's one piece of this. And I think to Kara's point, that the health department could help not only coordinate those efforts, but guide some of the promotion and make sure that we get the word out. But what I think came really true listening to Jan and to Arista is that you really need the social media avenues that the community that you're targeting uses. So it's great if, the health department uses Facebook, but if that's not what some of our target populations use, well, then we need to work with those populations to get the information out in the social media channels that they use. So I think those are the communication tools and the conversations that we need to have with our partners. And we'll take the lessons learned from the NAACP and from Arista to learn from what they've done to be so successful. So that's exciting to hear. About the town halls, what we were thinking is putting together a slate of speakers and panels to look at the vaccine confidence issue and also share the most recent rollout and distribution plans that the health department is learning from the state as we move forward. We also would love to hear from all of you, and we can talk about this more in depth at the next communication subcommittee, but happy to take some comments now on what you think might also be a good agenda or focus for those town halls based on the experience that you've had so far. So I'm happy to listen to everyone's thoughts on what those town halls might look like, not only in the language piece, but in the content.
This is Jan Geider. What I would suggest is we bring in the local media. The Daily Herald was very gracious and gave us space for a PSA. I had no, I couldn't get into the door with the Naperville Sun and other Tribune-owned papers out here. I would like to see us form some kind of partnership with the local media again to get their agreement that when we stage these events, they will publicize them.
Okay, yeah. And I think we also can, Jan, work on some of the other media partners. I know WGN has a community page, and there's some groups that we can maybe get that up there on some free promotional pieces.
Great.
Mm-hmm. That's a great tip, and sometimes we forget about that. So thank you for bringing that up. Anybody else on some of the content or focus that we should be planning with?
I have a question about content.
Mm-hmm.
2 things that keep coming up that when I talk to constituents are is the variant, the B117 variant. So if that can be addressed and talked about, I do know just doing my own research that the vaccines are assumed to also protect against this new mutation. But I think talking about the greater transmission rates and the need to get these vaccines as quickly as possible is something that I would really love to see addressed. The second aspect, and this is sort of an offshoot because this is not necessarily specific to the vaccine, but I wonder if we can somehow address the issue of long haulers, people who've had COVID and who are really suffering, with the after effects. I count myself in that group. I had COVID back in March, and it took 6 to 8 months to get over it. I still feel the effects. And there's a real lack of access to information, access to resources, and even knowing where to go to get help. So I think that would be a really wonderful subset of discussion that we could have, is offering people how to get help if you do have COVID.
It's almost a recovery type discussion.
Yes, very much so, because there's lots of things that can be done to help recovery. And our numbers are just so astronomical that we're going to be seeing more and more fallout from people who are dealing with post-COVID issues.
Thank you. I hadn't had that on my radar. I think that's a great one.
Thank you, Lynn. I think this question addressing to the Latino community, because they are asking, when they are a COVID, when is the best time to back to work? What happened with it? Many members of the family, they are positive in COVID. And how is the process with the family? And what do they need to, or where they can contact, to ask these questions? Because I learned this week that one of the family had a phone call from one of the, I don't know if it was the head apartment, and they give some instructions, but it was not clear. Again, there's still some question like, I need to go back to work. If I'm positive, what I need to do, or what is the risk? Details like that is so important. I need to be addressing, and again, how they can, or where they can find this information. This is very important.
Thank you, Reverend. About that, so you're thinking something also in written form, and then we can also have content in discussion in the town halls, if I'm hearing both of you correctly.
Yes.
Can I speak? I was thinking that what may make sense is some sort of handout pamphlet titled "You now have COVID, now what?" and then have medical professionals fill in what people should and can expect. Naturally, it's going to hit everybody differently, but there's some commonalities in COVID. And again, that if I walked out, or I got rated as positive, I just got the information, and I had this little pamphlet or booklet or whatever it is that I can start to read, maybe some of the symptoms may not come as a complete shock to me, because I've already gotten this document, and I'm not sure if I'm speaking properly or not, but it just seems like that would be a really good thing to have.
We could group a timeline and look at some of the existing CDC information that's out there and make sure that it fits well with what you're looking for.
Okay, I gotta grab a phone call.
Okay, very good, Michael. So I think I've got a sense of those pieces. Aside from the recovery aspect of COVID, the going back to work, what to expect after a diagnosis and what it means for you and your family. What do you think of, let's talk about the vaccine for a minute. In addition to the variant, any other content you think would be useful that should be a focus of the town hall regarding the vaccine?
The families with whom we work have a lot of questions about misinformation that they are hearing through social media and other outlets, that in the absence of a credible, safe, and trusted resource to debunk, gains more and more weight. So there are certainly questions that I think a lot of people have heard in regards to fertility. There are questions in regards to safety and efficacy, but there are also questions, especially amongst our Spanish-speaking families, and especially those who are immigrants without lawful permanent residence, around their safety from a legal and civic perspective in coming forward to participate in vaccination efforts. So we absolutely have families who are reporting back that there are rumors within their community that if they come forward and sign up for a vaccine, they will later be targeted for deportation or other actions. And so I think that where it relates to some of our immigrant communities especially, we need to do the best that we can to gather those rumors and then be able to give transparent and credible feedback to give people comfort where it's appropriate and acknowledge fears where they're also appropriate.
Thank you, Kara. I've noted all three of those. So I've got fertility, safety, and then legal aspects of coming forward and giving your information to be vaccinated. Okay. This does transition to kind of the deeper dive that a health ambassador could play into some of these issues, and having some subject matter experts and relatable leaders within the community. And I know we've talked about the need for faith-based leaders and elected officials, and definitely healthcare providers to be some of those ambassadors. Mayors and managers have done some nice social media campaigns on the 3Ws, and I don't know if you've seen those on Facebook or any of their outlets. Just recently, the health department shared a nice health ambassador type piece that featured some physicians talking about getting the vaccine and the importance of the vaccine. So I'm going to go ahead and scroll a little bit. Hopefully you can see some of this. It's in draft form, so we'll be looking at it in the communication subcommittee next week. But I wanted to show it to all of you. I'm going to send it to you in an email after this so you can look at it a little closer. We'd like to just get some feedback on this before we finalize the document. Keeping in mind that when you are a part of this, if you're doing a public service announcement or a radio, TV, or any advertising, the town halls, the health department could provide you some talking points. That's part of the backbone piece that Kara mentioned. So we could help develop some of the talking points and framework that you could use as a health ambassador. Same with community presentations. So I just want to stop there and get some feedback from all of you on this piece.
If I might ask this question, are you planning a special training for these ambassadors, specifically community-based leaders and faith-based? Because again, it's problematic that a lot of wrong information is out there. So how do we make sure that they are armed with very accurate information and that they believe what we're giving them?
I think the key there is the consistent message that comes from a reliable source. So the health department is looking at, and we do this for all of our communications, looking at the credible sources that we can use and we can adapt to be more local for DuPage County. So we would start with that, but I'd like to, as we're developing this plan, talk a little bit about the religious faith-based leaders and some of the others that might want more specific talking points than, say, a nurse or a physician may need. Nurses and physicians have a lot of resources in this area, and they may not need as much in the talking point, realm as some of our other folks do. So Jan, I think as a health educator yourself, and as having a background in public health, your input here is really important. When we talk to faith-based leaders, I'd like to see what they would look for. In the past, I think Asma mentioned that having a faith leader is really important for the Muslim community, and they would want a brief but a specific message. So just taking in some of what I've heard in the past, this is where we need to kind of get a sense of the type of messaging and kind of the leaders that we want to reach out to.
I can piggyback in there. The state of Illinois has put together a COVID ambassadorship program, and it's not exclusive to vaccine. It's more broad-based, broadly focused, but it has an infrastructure for training and support. And we might want to ask them if they would give us a quick look at what are they offering and how could we take advantage of that to ensure consistent, reliable messaging.
And Dave, Stephanie Cavillo, who's our public information officer, is I think tied into that program pretty well. So we'll continue to look for some structure from them and see if they have a good roadmap. But looking at how quickly we want to get these up and running, I'm a little, I want to make sure that we are doing this in a way that the communities that all of you represent can identify with, and that the information is on point. So thank you for bringing up the IDPH piece, because I do think that's really important also. But,
one of the elements, Mila, that just surprised me about the statewide effort is how incredibly diverse it is. I've registered myself and participated in an event a couple of weeks ago, and it was a wonderful experience of diversity.
That's great to hear. That's excellent. So looking at this bullet pointed list, I think there are a number of people that would be comfortable in doing some of these, maybe not all of them, but we would like to think about those town hall meetings and utilizing some PSA type work, which Kim would coordinate with our media folks and put that together. So we're going to talk more in depth about this at the communications subcommittee next week, which we are tentatively planning for 9 o'clock on Wednesday morning. So I'll reach out to the existing members of that, and anybody else that's interested, we can talk a little bit more about it then. And in the meantime, I will send this to you. Please send me your feedback, preferably, by next week on Wednesday, and we can take a look and finalize this document then.
One other comment relevant to this, Mila, it will also be discussed next Friday at that meeting that I had put a teaser out for through Impact Your Page. But a number of folks on this call are probably familiar with the fact that there is an RFP out right now for pandemic health navigators and community-based organizations and federally qualified health centers to participate in this pandemic health navigation project. For folks who aren't aware, it's a $14 million resource that's been provided to Page County and Kane County together. That is the region. And there are a number of objectives. We have somebody coming from Illinois Public Health, IPHA, to talk more about that program and its objectives to our community-based organizations at next Friday's Impact Your Page meeting. So if that's something you're interested in learning more about and whether your organization might have a role to play in this pandemic health navigation, it seems to me like there's a fair amount of intersection between pandemic health navigators objectives and some of this health ambassador work. So there might be some places where there's funding available to support it as well. This, I think we segue to you, Dave, and the mental health and substance use subcommittee discussion.
All right, very good, thank you. And Mila, would it be possible for me to share my screen?
Yes, I think it should work just fine, Dave.
Okay, let's give it a try. And as I'm doing that, I want to invite Jan to join in here. I have a couple of points I want to make to highlight for this team. What are things that they could be doing to advance good mental health during this period? I want to remind you all that it was about a month ago that we pulled together a subcommittee on mental health. And Jan reached into her Rolodex and brought us a couple of clinical experts from the community to talk about what they're experiencing. The health department contributed its director of behavioral health services. So we had a great panel to talk with us about what was going on. And I want to summarize what we learned at that event in this way. In this age, when financial concerns and crises are skyrocketing, so are mental health issues. And the biggest urgency that we face is how do we tend to the mental health crises of folks who are experiencing financial crises and aren't really in a position to absorb all this and make informed decisions. And the conclusion that we reached was that we want to use those places where there is a personal contact between a provider providing a crisis response service for financial, rental, utility well-being, and make sure that that person is equipped with a guide for mental health resources that are available. So I'm going to show you a resource in a moment that I think could serve for us as a basis for a tool. And Jan, you had a very specific description of that tool at one of our meetings a couple of weeks ago. You described a pamphlet or a flyer that had information that would be tucked in. Could I ask you to repeat that? It might be a long time ago now, that no longer fresh in your mind.
David, continue talking, and as
I will do that. So, okay, so then let me get to the two asks of the group and then we can keep moving. The first is that this is a really opportune time in DuPage because the county is launching a zero suicide initiative. So we here are a diverse group. It's our job now to look into our Rolodexes and say, where do we see colleagues that we want to encourage to become a part of this work group so that zero suicide from its launch is representative of our community and inclusive of a broad range of leaders. And you see on the screen here, Scott Kaufman at DuPageHealth.org. Scott coordinates the Behavioral Health Collaborative, and he would be your pathway in. If you have an interest yourself in participating in this group, if you have thoughts and ideas about people who should be participating, we want to encourage that. That's number one. Number two, let me, I've made a reference here in number two to a very fine 1.5-page summary of the crisis response resources that are available in DuPage County for mental health concerns. This is essentially in the form of a media release in English and in Spanish, and it's available at the DuPage County Health Department website. I'm going to show you that document and very quickly give you a sense of the two components that it's really important for all of us to be aware of and to think about how we're applying in our own circumstances with our own constituents. So here is that. Are you able to see this document? Oh my goodness, I do not have the most recent one. I think this might be an older one. So I'm so sorry, but I think it's going to give us an overview, but you'll find the more recent one on the DuPage County website. And I apologize that this is going to be more dated. So the first thing is what's available here in DuPage that is DuPage centric. And you see that right in the middle. There is a crisis services line that can be reached 24 hours a day. You can visit the health department website to learn more about it and to understand better how it can help your constituents. And so that number in that website are crucial elements for you to have in your hip pocket all the time when you're thinking about interacting with folks who are in a financial crisis and may also need a mental health support. In addition to these DuPage-centric resources, there are other resources that are helpful and available. Here is one, the Illinois Helpline for Opioids and Other Substances. And here are four more, excuse me. This format is not going to be the best one for you to use to share with your constituents, probably, but it's the core content, the core information that's sustainable, durable, and we want people in the community to know about it. And we especially want to focus on those folks who are in financial crisis, and our opportunity to reach them with this information is limited. We want to be responsive to them and make sure we're ready to go with this information when they need it. Our committee will be working to develop tools that can put this into the food boxes and other points of contact where folks in financial crisis are now touching support. Jan, is there anything that you would want to add or correct?
David, can I ask a question?
Mm-hmm.
So for mental health crisis line, is there any other languages available like Arabic or Urdu?
Well, I don't have the crisis line expert in the meeting here today.
Dave, I can check on that. And I do know that for the opioid helpline, they do have many languages available, and I've seen several utilized. So I'll double check.
And
we
Simon,
absolutely have access to the language line, and I'm not sure which one we're using right now for interpretation or realizing that's not always the best, but we certainly can access those for that crisis. Oh.
And Simon, what I commit is that as our subcommittee does its work, we'll build on this list of resources to include a guide and instruction about what language assistance is available. It's a really great point.
And Dave, you know, I know you were concerned about the date on that release, but all of these phone numbers and resources are valid. And
oh, good.
Yeah.
As always, check with the DuPage County Health Department website for the most recent and most accurate update.
And David, that's exactly what I do. So I'm I'm pretty sure whatever it was I said a few weeks ago, it was off the DuPage County Health Department's website. But I do want to make mention that we are finding that individuals who are living with comorbidities and especially diabetes are having a more difficult time, because diabetes is a very complex, very consuming kind of disease anyway. So one of the things that we are doing, the NAACP, is trying to put programs together to address issues that are related to diabetes and associated with COVID. And I put in the chat, I'll put it in again. There is an upcoming meeting on January 13th next week with a specialist, Dr. Searcy, who actually is certified by the American Diabetes Association for treating patients with diabetes. So I invite you all to Zoom into this meeting and to invite others that you may be serving to listen in as well. The plan is to have her speak, and we are going to gauge if there is enough interest to take this into a more detailed kind of meeting, and where we have breakout rooms and deal with people in small groups at a later time. But again, I invite you to look into this and to attend the meeting, but more importantly, to invite people that you're serving. You know, I keep telling my group, we don't want to preach to the choir. We want to find a way to get out and effectively reach people who are living with these diseases and help them. So if you can help us with that, I appreciate it. Thank you.
Thanks, Jan. And well, I think what I would like to do now, we have about 6 minutes left. I want to invite Kara to fill us in on the work group for PPE testing and vaccine.
Hi guys. The good news is that I think we are well on our way, and we probably had a little bit of advanced work that we were able to do on the PPE testing, and lots more work to do, of course, on the vaccine side. But reporting on the distribution of PPE, I'll share just a few updates. We continue to have generous access for anyone or any organization that needs it to face masks, both adult and pediatric, both reusable and disposable. If there's a clinical need for disposable masks that are surgical, you can reach out to my organization and we'll be happy to get you any of the supplies that you need. Similarly, and also with thanks to the health department has been distributing to a number of our food insecurity partners, as well as to the DuPage Health Coalition, a significant quantity of thermometers that we can in turn distribute out to the community for individuals who have school-age children that may be returning to school or who are trying to screen themselves prior to going to work to ensure that they don't have a fever. We still have thousands of thermometers are working through the distribution efforts for those, are providing them one to a household, anyone who requests one. So again, if your organization has a mechanism by which you might be able to share those, I know that we've given some to ICNA, to a number of our food partners, to VNA and others, and happy to continue to do that. The last piece of the work that we're doing on the PPE side has to do with pulse oximeters, and primarily we're focusing that effort on our clinical partners. So Access Community Health Network, VNA, all of the hospital emergency rooms, Hinsdale Family Medicine Medicine Center, a lot of the safety net health providers that provide significant care to either uninsured patients, Medicaid patients, anyone who's lower income who might struggle with access to that tool. And this is really appropriate for people who perhaps have been treated in the emergency room at their doctor's office. They don't need to be hospitalized, but they need to be able to monitor their oxygen levels. Or individuals who have been discharged from the hospital are safe to return home, but also need to be able to monitor at home. This is a very simple tool. We've actually taken the very complicated instructions that came with this pulse ox and translated them into a layperson's English and Spanish to be able to give people easy instructions to follow on how to use the tool at home and how to work with their physician to make sure that they're testing adequately and correctly. So if you have a partner organization that you think might benefit from those, we are tending to focus, like I said, on that side to clinical partners, because it's clinical partners that are best positioned to be able to identify who needs this tool. And we do have a little bit more of a limited supply, but all of our hospitals, or at least hospitals, I think right now, have them in their emergency rooms to distribute out, and also our SQHCs. I'm going to go back and defer to the health department for any vaccine healthcare workers updates that we haven't already shared. I know Chris shared a bit of that earlier on.
Could I just add that this group, probably about a month ago now, did a nice job of getting out the safety kit flyer, and the health department was able, with the help of all of you, to distribute 35,000 adult safety kits and almost 20,000 youth safety kits. So that's great. We still have some of those kits to give out if you have a need for them, and I can share the flyer and the link with all of you later. But that's a huge distribution between everything that Kara had mentioned, and then those additional 35,000 adult and 20,000 youth masks and kits. So if you have a need for more of those, please let us know.
And we're seeing in the chat, Dr. Asfar, you're noting that ICNA Relief has thousands of hand sanitizers, and you're wondering if others could make use of those. So that there's one more resource in the mix.
We cannot consume all of this. We have not received it, but it has been offered to us. It's 35,000 hand sanitizers, which will be expired in 2022. So it's very good 8-ounce bottles. And we can just decline the offer because we don't have a space. But if I was thinking if, DuPage County can receive it and distribute it, that'd be great.
So also, another thought that just pops into my mind is the Northern Illinois Food Bank. I wonder if they would be a repository for a large shipment like that and able to distribute it throughout their network. I'm sure you're connected with them, so it's something to put into the thinking.
Yes, I did send them email. No one has responded yet, but maybe they will respond today. Let's see.
Oh, good. Well, thank you for the offer. All right, I've got us at 10 o'clock, so we're going to close on time this morning. I want to thank all of you for coming in. I want to do 3 things as we close out here. The first is I'm suggesting that we gather again in 3 weeks. That would be on the 29th, and I'm asking my colleagues on the phone if there are any conflicts there that we should avoid or find a different time. Why 3 weeks? Because in 1 week, we're going to be having the Impact DuPage gathering, a deeper conversation on vaccine and vaccine confidence. And so I want to remind you all of that and encourage you to join into that conversation. You'll be notified about it today. Second, I want to remind you, Mila is looking for comments to her communications and ambassadors document. Great input today. Help her fill that out. And I think that's our 3. How does the 29th sound? Can we pencil that in? Good, we'll do that. And so I want to close this way. When we opened this call, Jan asked me how I was doing in all of this. And as I was expressing my woe, she turned that around and said, well, actually for her, a time of hope. and possibility, because the reality of what we face is better understood now than it was before. And that's a moment for mobilization. And I hope, Jan, I haven't mischaracterized or been unfair to you with that. So I started this meeting in a little low place, and I have ended it here. And I thank you all for your contributions, and I wish you safety and look forward to meeting with you soon. And we're adjourned.
Have a
Bye,
wonderful day,
everybody.
everyone.
Thank you.
Mom was thinking that he's gonna probably commit suicide.